uh, her study about the leukocyte differential score in patients with type 2 DM treated with diabetic vascular foot exercise. But at this time, Ibu Sunita will present by, she already sent the video to the committee members.
Assalamualaikum warahmatullahi wabarakatuh. Good happy day, everyone. I would like to say thank you for looking to my presentations. It's great to see you all. Let me introduce myself. My name is Sunita and I am from Poltekkes Kemenkes Bengkulu and Doctoral Study Program Faculty of Medicine Universitas Pajajaran Bandung, Indonesia. Okay, in this presentation, we will discuss about differential number of leukocytes in patients with type 2 diabetes treated with diabetic vascular foot exercise. I will present introduction, material methods, result and discussion, and conclusions. Introduction. Diabetes mellitus is a disease with a fairly high incidence in the community. The World Health Organization predicts an increase in the number of people with DM in Indonesia from 8.4 million in 2000 to around 21.2 million in 2030. In addition, the International Diabetes Federation also estimates that in 2035, the number of GM incidents will increase. Diabetic ulcers. Infection caused by tissue infection accompanied by the proliferation of microorganisms that cause tissue damage with or without an inflammatory response in host cells. Several factors cause diabetic ulcers, such as peripheral vascular disease, autonomic neuropathy, and peripheral neuropathy of the feet, in addition to trauma causing skin breakdown. Another factor that plays a role when GM patients experience diabetic ulcers is the presence of impaired wound healing that occurs intrinsically in patients. Material and methods. The research was also carried out after obtaining an ethics permit from the Bengkulu Health Ministry Polytechnic Research Ethics Commissions, as well as an informed consent from science by each prospective subjects. This study used a cross-sectional study design involving 30 samples before diabetic foot exercise and 30 samples after diabetic foot exercise, which were collected according to the inclusion and exclusion criteria to be designed as research subjects. The DIFCON examination at the Poltekkes Integrated Lab. This feature in the sequence of leg exercise used in this study. For exercise is performed use the Ministry of Health Diabetes for exercise. Research and discussion. Most of the subjects in this study were women. This is in accordance with the theory that women are more prone to suffer from GM because of physiological and genetic factors in terms of body fat accumulation after puberty, after childbirth, and because of menopause, which cannot be modified. Abnormal BMI is an important contributor in the pathogenesis of DM based on the criteria. A BMI of 26.12 kg per square meter is classified as overweight, while according to the Asia-Pacific criteria, it is classification as obese. A sedentary lifestyle and excessive calorie intake are major risk factors for developing DM. In a study, subjects were also characterized hematologically by examining the differential leukocyte count, table 2 and 3. In table 2, it can be seen that 50% of the leukocyte differential variables count variables whose values are usually distributed. Table 3 shows several variables that show significant difference. P is less than 0.005 between before and after the exercise intervention, namely segmental neutrophil, lymphocyte, and monocytes. Neutrophil as one of the lymphocytes and monocytes. Neutrophil as one of the polymorphonuclear cells were observed to increase in number, while the opposite occurs in mononuclear cells, namely lymphocytes and monocytes. Leukocytes are a group of cells that play a role in the pathogenesis and development of T2DM. Three types of leukocytes that can be seen get relatively much attention in the study in the pathogenesis and complication of T2DM, namely neutrophil, monocyte, and lymphocytes. Inflammation that occurs in diabetes has been reported to be associated with decreased neutrophil functions. Conclusion: there is only a significant difference in the number of segmented neutrophil cells, lymphocytes, and monocytes in diabetics before and after the diabetic vascular for exercise interventions. Thank you and always happy. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Ibu Sunita, for kind presentations and you sharing your study about the leukocyte differential count in patients with 2GM treated with diabetic vascular exercise. And we have Ibu Sunita here and Ibu Dr. Halimah. Do you have any comments or anything that you would like to give to the to Ibu Sunita studies? Thank you.
Okay, thank you. This is a nice study. I want to know, so what kind of food exercise is meant that has an impact on the immune cell response? Why jogging or leisurely walking doesn't have an impact on immunity for DM. Bagaimana dengan jogging atau jalan santai? Apakah tidak ada dampaknya terhadap immunity dari DM?
Okay, thank you, Ms. Halima. For exercise that has an impact on the immune cell response is the diabetic foot exercise that I have explained in my oral video. Diabetic foot exercise can be done regularly every day. In a study carried out by subject in the morning and or evening, anywhere can be done while relaxing with family and while watching television. Like exercise can be done in standing, sitting, and sleeping position. For exercise can be done by moving the feet and the joint of the base on the feet. For example, standing with both heels raised, lifting the feet and lowering the feet. Movement can be in the form of bending, strengthening, lifting, rotating outward and or inward. Apart from that, the movement of gripping the tooth is also for a diabetic foot exercise. For jogging or leisurely walking, there is also an impact on immunity for diabetes, but this is not the focus of my research.
Okay.
Thank you, my answer. I hope it is useful and acceptable. Thank you, reviewers.
Okay, so that's what is Dr. Halima's comment is, I think, the suggestion for the next researcher, right?
Okay, okay, thank you.
Thank you. Okay, thank you so much, Ibu Dr. Halima, for a good comment, and also to Ibu Sunita for a very good response to Ibu Dr. Halima's comments. Thank you once again to the all presenter and also to the all audience here. We really appreciate your enthusiasm about this event. We know that